Hi, good morning. I'm Raiman and you're watching ASEAN Kita, a show where we explore the stories, challenges and opportunities that lies within the region. Across Southeast Asia, the population is aging faster than many policymakers expected. Fertility rates are falling, life expectancy is rising, and by 2035, nearly 1 in 5 people in ASEAN will be over 60. But how prepared are we? Who bears the cost, and what does aging mean, not just for healthcare, but for jobs, pensions, urban designs, and perhaps even technology adoption? Today, we're asking what it truly takes to age well as a region and whether ASEAN is moving fast enough. Joining us this morning is Associate Professor Dr. Rahimah Ibrahim, Director of Malaysian Research Institute on Aging. Dr. Rahimah, thank you for being with us. Let's get right into it. What are the clearest signs that Southeast Asia is no longer a young region? Are we already seeing the shift in population structures across countries?
All right, okay. So imagine pressing twice the speed on a video. Okay? In 2000, only 5% of ASEAN citizens were over 65. Today, it's almost 10%. Singapore has already hit 18%, and Thailand hovers around 14 to 15%. The number of working age residents supporting each senior in Singapore has collapsed from about 10 to 3.5 in one generation. The youth bonus is ending for some members, even while it is just opening for others. So the key message is our demographic clock is ticking faster than our policy clock. So we need actions and we need it fast.
And Prof. And Doctor, why have fertility rates dropped so sharply in some ASEAN countries while staying high in others? And how might this different path affect the region's workforce in perhaps the next 20 years?
So think of it as two traffic lanes. So we have one with ultra low lane due to housing costs, later marriages and women's careers. And these social changes have pushed fertility to 0.97 in Singapore and roughly about 0.9 to 1% in Thailand. So we have another lane, which is the moderate lane. This is due to rural livelihoods and also faith-based norms that keep the Philippines at 1.9% and also Laos around 2.4%.
Mm-hmm. And then as the number of
1.9 and 2.4 in terms of the total fertility. Yeah.
Mm-hmm. And Doctor, as the number of retirees rises and working age population shrinks, who's most likely to bear the financial burden? Is it governments or families or maybe businesses, and why?
So when we talk about this, it's always the current workforce. It's just a question of how. So we need a three-pot system. The first is the through mandatory savings like EPF or CPF. Second pot is the small payroll levy earmarked for long-term care. Thailand is currently drafting one at roughly 0.3 to 0.35% of their wages. And the third pot is the tax finance basic pension so that no elder slips through the cracks. So the risk has to move from our living room to the nation.
Mm-hmm. And when a country crosses that 14% threshold of people aged 65 and above, what are the first signs of stress on the healthcare system, and how can early prevention efforts help manage the rising costs?
So countries typically add about 1% extra of GDP to health and care within a decade of crossing that line, largely due to chronic disease and frailty. Yet South Korea, in between 2019 to 2022, they pilot an integrated care which links hospital discharge to home nurses and social workers. And this pilot has shown that it can cut avoidable admissions by 12%. So Singapore also did another program on Grab bar retrofits that cost about US 120 per home, but this pilot was shown to avert a US 5,000 hip fracture bill. So the key message is that early prevention beats large later stage hospital cost always.
And perhaps have we seen examples of cities in ASEAN that have successfully made their transport, housing, or perhaps public spaces more age-friendly? Who led or funded the efforts, Doctor? And could they be replicated in also less wealthy cities in the region?
Okay, so I will discuss, I think, about 3 examples. The first one is in Singapore. The government funds upgraded lifts and friendly streets, and the program covered 400,000 flats, which now have direct lift access. And then in Thailand, a 2% Syntax health fund plus tourism levies poured into low cost concrete ramps and tactile parts. So and then they hire volunteers to upkeep the facilities. And here in Malaysia, in Penang Island, the city council and NGO walk neighborhoods with older residents, and they map hazards and fixing each area for under 40,000 ringgit. So start with paint, benches, and lighting before chasing big budgets.
And perhaps, Doctor, if in your perspective, in your point of view, what was the biggest obstacle, or what could be the biggest obstacle in implementing this urban friendly, which is more age friendly to those who are aging, and what was the biggest obstacle? Is it funding? Is it bureaucracy in rolling out these age friendly upgrades?
So age friendly, it's just another framework, and many countries or even state governments, they follow different. They have their own state initiatives or state framework. So sometimes these kinds of age-friendly initiatives get overlooked, or they are not funded by any of the existing initiatives. Like the smart city or safe city. So there are too many programs around that it could be competing. It could be seen as a competing priorities. And also resources, but actually you can align all these initiatives to make it more coherent and coordinated.
And in your view, who are the most vulnerable groups among older adults in ASEAN? We have women, we have persons with disability, and what should be done to make sure the social protection system do not leave them behind, Doctor?
So the most vulnerable would be, women over 75, rural or informal sector retirees, frail or disabled elders, and anyone living alone, especially migrants and indigenous seniors. So the key message is that we should give everyone a social protection floor and target extra help to the frailest.
And also, ASEAN often looks to Japan and South Korea for policy inspiration. What lesson from their long-term care or perhaps community health models might actually work here, and which one wouldn't translate well?
Okay, for Japan, Japan's experience shows that the power of predictable funding and professional care managers, but its premiums are too heavy for rural ASEAN. For Korea, Korea has proven that linking hospitals and to home and social care saves money, but you need a strong local government and broadband. So the key message is we can copy the principle like the risk pooling plus the case management, but start lighter and scale. So we should copy the principles, but not the budget or yeah.
As you mentioned that Korea invested heavily in community health aids. perhaps what skill set would we need to replicate that kind of workforce here? Because we have been talking about Malaysia itself, we've been talking about the care economy here. So what perhaps skill set we need to replicate it across maybe Malaysia and also ASEAN as a region?
So as a care worker or care navigator in the community, you should like the person should understand what it means to age. So they need to know how a person age and what happens to them functionally. Yeah, so what happens to a person's functional status when as we age. Yeah, that can include with or without any chronic diseases, and what happens to their functional status and their social participation in the community. And other than that, you need to understand how best to support older adults in the community, learning skills such as supporting with personal care, communication, helping with medication management, supporting with skill set, the skill set that will be useful for a care aide or a care worker in the community.
And if, Doctor, if we fast forward to 2035, what would be your personal benchmark for judging ASEAN's success in handling aging, and why does that single metric matters to you the most?
My personal metric would be healthy life expectancy at age 60 or HAIL 60, because today Southeast Asia averages about 13.7 healthy years after 60. So if every ASEAN member reaches 16 years or more by 2035, and we keep total health spending under 8% of GDP, we will give older people nearly 3 extra good years and protect the national budgets. So we want more healthy years, not just more years. So this is the real victory lap.
Well, there's still a lot to unpack on ASEAN, on ASEAN Kita, on how ASEAN can prepare itself for an aging region, with our guest, Associate Professor Dr. Rahimah Ibrahim, Director of Malaysian Research Institute on Aging. But we'll take a short break and we'll be right back after this.
Nak coklat?
Hari ni tak boleh. Nanti saya kena dengan mak saya.
Pepsodent baharu disahkan halal. Microkalsium aktif dan Proflorida Complex membantu memperbaiki lubang halus akibat makanan manis sebelum menjadi kaviti untuk pelindungan maksimum. Pepsodent.
11 Jun ini, sertai kami di Pavilion KL untuk Big Stage Alpha Showcase. Temui finalis yang anda nanti-nantikan. Persembahan daripada Hale, Sheila Amzah, Nadira, Wani Kerry, Isaac Vu, Kowax, Akim dan Amir Masdi. Datang awal dan tunjukkan My Astro app anda untuk masuk ke zon Superfan. Anda juga boleh memenangi pas fan meeting melalui Astro Rewards. Tunjukkan sokongan anda. Jumpa kami di Pavilion KL.
Di dalam setiap berita yang dibawa, konteks amat penting. Kami sentiasa membawakan yang tergempar dan terkini. Pastikan Astro Awani menjadi pilihan anda, tidak kira di mana sahaja anda berada.
Welcome back on ASEAN Kita. On today's episode, we're discussing on how ASEAN can prepare itself for an aging region with our guest, Associate Professor Dr. Rahimah Ibrahim, Director of Malaysian Research Institute on Aging. Now, the first block, we focus on ASEAN. The second block, we want to focus a bit more on Malaysia as we are the chairman of ASEAN 2025. But how can we as a nation lead by example? Dr. Malaysia is expected to hit aging nation status by 2030. How ready is our existing pension pillars? How ready are we in terms of EPF, in terms of public service pension, to support much larger retiree base?
Okay, so in Malaysia, we already crossed the UN Aging Society threshold, and which says that 7.7% of the population now age 65 and above. Approximately 0.6 million people 65 and above right now, up from 7.4% just a year earlier. So at the same time, our social welfare outlays are rising. the Bantuan Warga Emas monthly cash benefits was raised from 600 in budget 2025, a 20% jump in a single year. Health spending has also climbed to 6.5% of GDP in 2022, yet none of that is earmarked for long-term care, specifically. So we are not ready in terms of the systems for long-term care that the population will need with rising age. Yeah.
And you mentioned that we are not ready in terms of aging, as we are an aging nation status by 2030. But what specific reform, or perhaps higher contribution rates, or a universal basic pension, or perhaps a flexible retirement age should be prioritized by the government?
So Malaysia is currently a mix of modest welfare transfers, and then we have fragmented regulation and high out-of-pocket spending. And these are neither equitable nor scalable. So we need a reform on long-term care, especially on the long-term care insurance, which is a pooled social insurance scheme tied to functional need. And this can deliver a form of protection. So these kinds of systems, the current social protection system is inadequate to cater for our longevity, the increase in our longevity, and without structural changes to our current system, we are bound to face some crisis in the future.
And if I could bring you to the National Health Policy for older persons, it emphasizes aging in place. What practical steps? Is it home-based care subsidies, or perhaps community nurses, or digital health monitoring that the Ministry of Health is trying to emphasize on digitalization, can make aging at home safe and also affordable in Malaysian suburbs and in the villages as well?
Okay, so for aging in place to happen, we need more community-based alternatives in terms of health and care. So just imagine, like, if you come out from the hospital post-stroke, after a stroke, and then after you have been stabilized, you are advised to go home, and suddenly there's nothing in the community that can support you to get well at home. So families have to either purchase the services or find any family members that can help them to recuperate at home. So without community-based care services, the aging in place will not happen, and digitalization is, of course, a way to improve services, but we have to also remember that not all older adults are well versed with technology. So digital literacy has to be deployed as well, or implemented. So classes on teaching older adults how to use smartphones and whatever apps that they need to access services must also be deployed.
As you mentioned, that a lot of steps needed to be taken before we can implement aging in place. But also another aspect is caregiver burnout is a term that has been raised many times by experts, or been warned, and as caregiver burnout is rising as families has to shoulder more responsibility. Should perhaps the government or Malaysia introduce a caregiver allowance, or perhaps tax relief, or a paid family care leave, and to ensure that caregiver burnout is not going to happen in the future, as we are going to be an aging nation by 2030, Doctor?
Okay, I think we can start like from employers becoming more sensitive to the care needs, and like becoming more family friendly, for example. So knowing that care does not only happen from, from parents to children, but now from adult children to their parents. So employers should have this kind of mindset to support their staff who is having care responsibilities, and provide some support from the management perspective, or from the employer's perspective, such as supported leave, and also getting getting some assistance, to carers, providing care for frail of sick family members. So what we need to understand is also that these caregivers are actually diverting their productivity from the labor force to to caring for someone at home who is requiring care. So if we can support them, they can actually continue to be more productive. If we support carers to perform their roles, or to perform their responsibility.
And you mentioned that employers need to be a bit more sensitive in terms of this issue. But recently, Putrajaya or Minister Azalina Othman Said has floated the idea of retirement age to be uplifted to the year of 65. What do you think of the idea? How do you read into this situation? Is it a good idea or a bad idea, Doctor?
Okay, so actually, we have been deliberating on, upping the retirement age, and every time it happens, people are not happy. Some camps are not happy because it there are pros and cons to it. At my aging, and myself personally, we believe in allowing or making it more supportive for people who wants to work or have to work, because so we should look at removing the barriers for older persons to or senior workers to work if they want to work or they have to work. So instead of upping the retirement age, we should look at removing stereotypes or structural barriers for individuals to continue working if they are able and feel useful through contributing to work. So we should remove the stereotypes, and also the barriers to employment for senior workers.
And if I could bring your attention to your own opinion piece, Doctor, in May 2025, your opinion piece, you warned that Malaysia has roughly 60 geriatricians but needs 10 times that number by 2013. What specific incentive would realistically grow that pipeline, perhaps within 5 years down the road?
Okay, so I've been hearing from many colleagues that geriatrics is not a sexy line, like people would go for cardiovascular or even other specialties, so but not geriatrics. So we need some incentives to build this pathways or this pool of geriatricians in our country, because this specialty, specialized skills will be required in terms of looking at the overall health conditions of older adults, not just in a particular organ or in a particular setting or department. So a geriatrician is someone who can do a comprehensive assessment of an older person and see what changes need to be made in terms of their medication, in terms of their treatment. And in terms of incentives, we have to make this career pathway as an attractive career path for youngsters, and to make it more relevant to our society. We have to make sure to educate why we need more geriatrician, why we need more doctors who knows about older adults' health conditions. So with awareness and also with incentives, from, because they only train sometimes a year only one geriatrician, so that's not enough. And of course, without any mechanisms to support this career path, people will run away from it.
And if I could bring your attention to your last year's National Conference on Aging, you argued that the Malaysia's health, housing and social welfare ministries are still working in silos. So perhaps if you could recommend what practical mechanism that could break those silos most effectively, Doctor?
Okay, so yes, silo is not easy to break because it is what it is, and people have been working in that kind of system for many years. So we have to look at why breaking silos is very hard. The first one is we still have structural budget silos. So the health and welfare budget sits in 2 ministries with different parliamentary committees. So reallocating these funds means sometimes could mean losing their turf, and secondly, we have legal and regulatory split. The healthcare is our healthcare is regulated by the Private Healthcare Facilities Act, residential care, or the care center by the Care Centres Act, and there isn't any law that obliges joint commissioning. So we need a legal framework that bridge the two split, the legal and regulatory split. And also in terms of professional and identity and the KPI culture in our ministries. So our doctors are evaluated on medical outcomes, social officers on the cash transfer throughput, but there's no cross-disciplinary KPI because nobody measures their success. And our policymakers are still fearful that formalizing social care will let families off their hook. So we still believe in the family will take care of their members, so programs are still optional and underfunded. So because we still believe in our family-centric norms. And on top of that, we have data silos. We don't have any data exchange between health and the social side. So the risk stratification stops at the hospital gate.
Okay, we would like to thank Associate Professor Dr. Rahimah Ibrahim, Director of Malaysian Research Institute on Aging, on how ASEAN can prepare itself for an aging nation. As Malaysia and the region face a demographic turning point, it's clear that how we treat our older citizens today will shape the society we become tomorrow. Thank you, Dr. Rahimah, for helping us better understand what it takes to age with dignity, resilience and also care. That's all the time that we have on ASEAN Kita today. I'm Raiman. Thank you for watching and see you next time on ASEAN Kita.